Well, good morning, and thank you all for joining us for a news conference about the launch of a really important program that's going to enhance the health and well-being of our youngest community members and their families. Joining me this morning are Lincoln-Lancaster County Health Department Director Pat Lopez, board-certified pediatrician Dr. Stacy Bleicher, Lincoln City Council Member James Michael Bowers, Lincoln City Council Member Benny Shobe, Lancaster County Board Member Sean Flowerday, Tiffany Nordmeyer, Director of Women and Children's at CHI Health St. Elizabeth, and Alexa Lewis, Director of Women's and Children's Services at Bryan Health. And I also want to acknowledge that here with me in the room are some incredible public servants and leaders in our community, County Board members Rick Vest, Roma Amundsen, and Krista Yoakum. And we could not be here today without their leadership. So we are here, and also want to say thank you to Margie Prop for bringing her interpretation services so that more people can access this important information. Here in Lincoln, we know that strong families make our communities strong. We also know that when we invest in the health and well-being of all Lincoln families, we become an even stronger and more successful community. Our Universal Home Visitation Program will help lay a strong and healthy foundation for the smallest members of our community, who one day will play the biggest role in our future success. This program is led and implemented by our outstanding health team at the Lincoln-Lancaster County Health Department. And Health Director Pat Lopez is here to provide all the specifics about this invaluable effort to support Lincoln and Lancaster County's families as they grow. Director Lopez?
Good morning, and thank you, Mayor. We appreciate your support in this effort, as well as our city and county officials, Board of Health members, and our many partners in the community. As the Mayor mentioned, through Family Connects Lincoln-Lancaster County, all families with newborns will be offered a home visit from a highly trained public health nurse within 3 weeks after birth. Participation in this program is voluntary, and there's no cost for the home visit. Having a child, as we know, is one of the most exciting, life-changing events that can happen. And it can also be overwhelming and stressful for parents to adjust to a new family dynamic. With Family Connects, friendly and knowledgeable nurses are there to lend a helping hand, to listen and answer questions, and provide support and resources for families to give their children a healthy start. Our public health nurses will be connecting with families at local hospitals to schedule their home visit, with the first home visit starting early in September. Here are some examples of what happens at a home visit and how our public health nurses can address families' needs. They will check on the baby's weight and height and health, and check on the mom too. They can help with breast or bottle feeding. All our nurses are also certified lactation consultants and offer tips on how to soothe newborns. Nurses can answer patients' questions and link them to community resources. Strong partnerships and tremendous support from the community are key to making universal home visitation a reality. The Health Department developed a foundation for the program with the support of the Mayor, the City Council, and the County Board. But this also included working with our local hospital systems, Bryan Health and CHI St. Elizabeth. Healthcare providers and experts in early childhood also have helped to build capacity and resources, along with recruiting, hiring, and training professional nurses. It is through these partnerships that many families will learn about Family Connects, whether it's from obstetrics providers during pregnancy, or through connecting with a public health nurse in the hospital after delivery, or from their pediatrician or family practice provider when they take the baby in for those initial well baby checks. Family Connects is an evidence-based home visiting model that has been implemented in 19 other states. And according to their studies, when families use the program, mothers feel less anxious, they were more likely to complete a 6-week postpartum health check, and they learned about quality child care options. Data shows that 97% of the families served by the Family Connects home visitation program are referred to at least one resource, and child emergency room visits were reduced by 50% through the age of 12. We're pleased to add Family Connects to the Health Department's array of programs and services that positively impact the health of local families and our community. Mayor?
Thank you so much, Director Lopez. And joining us next to talk about Family Connects from the physician perspective is Dr. Stacy Bleicher, a board-certified pediatrician and member of our Lincoln-Lancaster County Board of Health. Dr. Bleicher?
Thank you, Mayor. I am very excited to see this home visitation program being introduced universally in our community. I have long been a supporter of home visitation and the very important role it serves in the lives of our families. The hospital stays are quite short. There's a ton of information that parents have to absorb during that time. They often don't know what's going to happen when they get home, and they have very little time when they leave when they're forced to leave the hospital, basically, to prepare for that. So it's very good to have supports in place that can meet them where they live and help them deal with questions and supports. We see more and more in pediatric practice that our families do not have a lot of built-in supports. They may or may not have extended family to be with them. If they are new immigrants, they may not understand cultural norms of care in our community. There are all kinds of information that can be achieved by going and meeting them where they are. And it indeed forms a very good foundation to be sure that we start these families off to a healthy start, getting information that they need. And I think a very big important part of that is being connected to the community and understanding that those connections do indeed exist. The experience of being parents at home with a new baby can be very isolating, and this offers an option to minimize those isolated feelings. So I'm very excited to have this in place. As a pediatrician, I would be pleased to have these highly trained, skilled visitors in the home who are more highly connected to the community resources than I can be as a practitioner. Thank you.
Thank you so much, Dr. Bleicher, for your service and your leadership. By approving the funding for this program in our city budget, the Lincoln City Council played a key role in today's announcement. And Lincoln City Council and Lincoln-Lancaster County Board of Health member James Michael Bowers has been a really strong advocate for supporting families and children. And I'd love to have him come up and say a few words about the importance of home visitations. Councilman Bowers?
Thank you, Mayor. And I would also like to thank City Councilman Benny Shobe for his assistance in getting this across the finish line through the City Council branch of government. Today we're gathering for a shared purpose, to kindle a brighter tomorrow for our city and a tomorrow where every child's potential knows no bounds. Investing in the well-being and development of our youngest residents is crucial for future success and prosperity of Lincoln and Lancaster County. This collaboration will ensure that every infant in our city has a fair shot at a bright future. Universal home visitation using the Family Connects model can help us address existing disparities in our community regardless of income or background, and all families will have access to these services, leveling the playing field and giving every child an equal opportunity to thrive, leaving no family behind during one of life's most impactful times. This initiative will bring Lincoln and Lancaster County closer to the vision of a community where every cradle holds the promise of a bright future. One where the next generation can receive the building blocks they need to reach their potential, and one where our city and county has a more radiant future. Prioritizing the well-being of our youngest residents should be and will always be a priority for us.
Thank you, Councilman Bowers, and thank you, Councilman Shobe. And thanks to the Lancaster County Board of Commissioners, the reach of this home visitation program will extend throughout Lancaster County. So joining us today on behalf of the County Board is Board of Health member and County Commissioner Sean Flowerday. Commissioner Flowerday?
Thank you much. Evidence-based maternal, infant, and early childhood home visitation has been proven to greatly improve lives for years to come. And I'm extremely pleased to report that 2 days ago, the Lincoln and Lancaster County Board of Health adopted a formal resolution in support of officially launching an evidence-based, completely voluntary, universal home visitation program for our community. This effort is about giving every single one of our families the protection, knowledge, resources, and strong start they deserve during a changing time, regardless of geography, demographics, educational status, economic status, or previous pregnancies or births. We know that support for families, pregnant mothers, and very young children is the most effective investment our community can make. It pays for itself many times over in reduced costs in health, education, and criminal justice, not to mention the greatest return of all, better lives for families and young people. The resolution passed by the Board of Health on August 8th is the first step in providing the tools and services necessary for parents and young children to succeed in Lincoln and Lancaster County. These efforts represent the best in us, and I'm deeply proud of the commitment made by our community to its families. Thank you so much. Thank you, Mayor.
Thank you, Commissioner Flowerday, and thank you to our Board of Health, and thank you to the entire county board. Our hospital systems are integral to the success of the Family Connects program, and both CHI Health St. Elizabeth and Bryan Health will be working really closely with our Lincoln Lancaster County Health Department to help connect families to the resources this program offers. And here to talk about why this partnership is so important is Tiffany Nordmeyer, the Director of Women and Children's at CHI Health St. Elizabeth. Tiffany?
Thank you, Mayor. At Common Spirit, our mission calls us to improve the health of those we serve. We're honored to have the opportunity to make a positive impact for families and children through our partnership with the Lincoln Lancaster County Health Department and Bryan Health. Birth is an exciting and kind of scary time for families. We know that every family is vulnerable after the birth of their child, so it's really important that every family be given the opportunity for success. We also know that every family is unique, and this is why it's essential that each family is matched with the support they need. Together, we can improve outcomes for the families in our community. Thank you.
Thank you, Tiffany, and to your colleagues. And for another perspective from our hospital partners, we'd like to hear from Alexa Lewis, the Director of Women's and Children's Services at Bryan Health. Alexa?
Thank you, and good morning. At Bryan Medical Center, we are excited about the Family Connects Universal Home Visitation Program because it extends patient care to our families beyond the hospital. This program will help to ensure the family unit is transitioning well at home and has necessary referrals to community resources to provide assistance and ongoing support for success. The partnership of the Lincoln Lancaster County Health Department and Bryan Medical Center helps us to meet our mission of advancing the health of individuals in our region through collaboration with physicians and communities. The Family Connects Universal Home Visitation Program is one example of how our local community comes together to serve our neighbors and the overall well-being of the city. Most families stay in the hospital for about 24 to 72 hours after delivering their newborn. Much of that time is spent bonding with the newborn, adjusting physically and mentally to the postpartum period for the delivering parent, also learning how to feed, bathe, and care for the newborn. Many of our families are sleep deprived and are grasping just the essential information to discharge from the hospital and return home to their family and community. Being able to offer each delivering family in the Lincoln Lancaster County area a universal home visit will help extend the care of the family far beyond the walls of the hospital or the clinic. The nursing staff will be assessing both physical and mental well-being of mom and baby. The staff will help to refer individuals to necessary resources and care providers before an urgent or emergent situation develop. This partnership with the health department will help to reinforce many of the concepts that were taught during their pregnancy or at the time that they were in the hospital delivering with us. As the program continues to develop and prove how incredibly beneficial it is for mothers and babies, I believe we will see improvements in long-term maternal and infant health. Thank you.
Thank you, Alexa. The launch of our new Family Connects program emphasizes how our city, our county, and our community continue to work together and have a shared commitment to enhancing the safety, health, and well-being of all Lincoln residents from day one. With that, we would be so happy to open things up for questions from the media about this exciting program.
Oh, I have one. How many nurses have you hired for this, and how many people do you expect to serve, say, in a year?
Right now, we have 4 nurses on staff, and we expect to hire 4 more. We expect that approximately 70% of all newborns in the community will be served. So probably close up into the 1,500 to 1,600 range that we'll reach. Of course, we want to strive for 100%, but just looking historically at the data.
And you had, this program existed before, but it wasn't for all families, is that right? Can you maybe explain what existed previously and how it's changing?
Well, years ago, our community used to have a universal home visitation program, but through a series of other situations, that was discontinued. So we're bringing that back. But right now, we do have a home visitation program for families that have greater needs than just a few visits that will be provided for through the Universal Home Visitation Program. So what happens now is with Universal Home Visitation, we will be able to refer families that might have some greater needs onto the other program where they will also continue to receive services and be connected to resources in the community. The Universal Home Visitation Program is meant to be about 3 visits and get families connected to what they need. And if it goes, if their need is greater than that, then we have the resource to meet that need.
Any other questions? Okay. Thank you so much. We're really excited to be launching this important program, and it really has taken a village, and we're excited about how it's going to make our village here in Lincoln a lot stronger. Thank you.